Hello, today I'm going to talk about computed tomography and MRI of brain. First of all, let's discuss some anatomical part of the brain. Brain is the one of the largest and most complex organ in the human body, and the adult human brain weighs on average about 1.5 kilograms with a volume of around 1,130 cubic centimeters in women and less in men. Our brain gives us awareness of ourselves and our environment. It is processing a constant stream of sensory data, controls our muscle movements, secretions of our glands, and even our breathing and internal temperature. Every creative thought, feeling, and plan is developed by our brain, and the brain neurons record the memory of every event in our lives. Brain has three main parts. This first is cerebellum. It's the largest part of the mature brain, which consists of two large masses called cerebral hemispheres, which are almost mirror images of each other. And the cerebellum is concerned with higher brain functions in interpreting sensory impulses and initiating muscle movement. It stores information and uses it to process reasoning. It also functions in determining intelligence and responsibility. The surface of cerebellum has a folded appearance called the cortex, and the cortex contains about 70% of the nerve cells. These cell bodies color the cortex in a gray-brown color, and because of this, its name is gray matter. And the fibers between the neurons called axon, which makes white matter because it has white appearance. Cerebellum, it's a rounded structure which is located behind the brainstem, which is linked by thick nerve tracts, and it accounts for about 11% of whole brain weight and appears similar to the cerebrum. It is concerned mainly with the main sense of posture and balance and the coordination. Brain stem, it houses the midbrain, mesencephalon, pons, part of the metencephalon, and medulla oblongata, myelencephalon. This is the posterior area of the brain, which attaches to the spinal cord. At this brainstem, where information is sent back and forth between the cerebrum and cerebellum and the body. Cranial nerve from 3 to 12 are located here, as well as significant processing centers. On the brain, each hemisphere, we have two hemispheres, right and left hemispheres, and each hemisphere is divided into several lobes. These are frontal lobe, which is responsible for personality, behavior, emotions, judgment, planning, problem solving, speech, speaking and writing, and we call this Broca's area. If this area, if there is any disorder or any process in this Broca's area, the patient can't speak and writing. Also, frontal lobe's function is body movement, intelligence, concentration, and self-awareness. A second one is parietal lobe, which interprets language, words, sense of touch, pain, temperature, interprets signals from vision, hearing, motor, sensory, and memory, spatial and visual perception. And occipital lobe interprets vision, color, light, and movement. We have one more lobe, temporal lobe here, computed tomography, axial plane. We see right and left frontal lobes, right and left parietal lobe and right and left occipital lobe. Here we have on this view, again, computed tomography of the brain, axial plane, right and left temporal bone, which are responsible understanding language, which we call a Wernicke's area, memory, hearing, sequencing, and organization. Also, cerebellum is divided into two hemispheres, right cerebellar hemisphere and left cerebral hemisphere. Falx cerebri, here is located falx cerebri, which divides into two hemispheres. Here we have pineal gland, choroid plexus, occipital lobe, frontal lobe, lentiform nucleus and internal capsule, thalamus on both sides, lateral ventricles, frontal horns of lateral ventricles, Sylvian fissure is located here. Sometimes in the brain, this pineal gland and choroid plexus, you see that it appears as a white here. After some age, after 40 age mostly, there are physiological classification of these two areas, pineal gland and choroid plexus, and we don't say that it is disorder or abnormality. It is normal in after some age. Here, magnetic resonance imaging of the brain, axial plane. Here you see lateral ventricles, two lateral ventricles. Here will be occipital lobe, frontal lobe, and parietal lobe on both sides. Again, axial plane, computed tomography, orbits we see here, optic nerves, which are located here, sphenoid sinus, nasal cavity here, and sphenoid sinus. Here will be cerebrum and cerebellar hemispheres. Here is located fourth ventricle. Principles of CT. Why we need to scan computed tomography? Because internal structures of an object can be reconstructed from multiple projections of the object, and we can see better any kind of abnormality inside the brain tissue. It is uses X-rays applied in sequence of slices across the organ. Also, images reconstructed from X-ray absorption data, and X-ray beam moves around the patient in a circular path. And terminology, we use Hounsfield unit, which means attenuation of X-rays by different tissues. So you know that different tissues attenuates X-rays in a different way, and because of this we see, for example, bone in a white color, air in a black color. A soft tissue has different density. So Hounsfield unit we use only for computed tomography. So we describe different densities in a Hounsfield unit. For example, bone has plus 1000 Hounsfield unit. Air, water has 0 Hounsfield unit. Air minus 1000. Blood 40. Liver Hounsfield unit will be from 40 to 60, and so on. Pixel and voxel. Each square of the image matrix is called pixel, and thickness of the tissue is called voxel. So basics about, we know all of this. So X-rays are absorbed to different degrees by different tissues, as we said, and it will have different densities. But we need to describe these CT findings in densities. And we use these terms: isodense, hypodense, and hyperdense. So everything what will be higher in the density will be whiter in the appearance, and lower in the density will be darker. The appearance and brain is the reference density. So we compare everything to brain density. Anything of the density as brain will be isodense. Higher density than brain will be hyperdense. For example, skull is the best example of this, because you know the skull has white on computed tomography, white color, and it will be hyperdense. And anything darker than brain will be hypodense. For example, lateral ventricle are hypodense on computed tomography because lateral ventricle contain cerebrospinal fluid. Also, air is classical example of hypodense when we are describing something in hypodense density. CT artifacts. What are CT artifacts? Artifacts are distortions or errors in the image that are unrelated to the object scanned. And most common artifacts in CT are motion artifacts, slit artifact, beam hardening artifact, partial volume averaging artifact, ring artifact. So sometimes these artifacts may simulate different kind of mess or different kind of disorder. For example, here we have artifacts. So what makes error in the image, we call these artifacts. For example, metallic implants and surgical clips can cause many times artifacts on computed tomography. So why do we use and when do we use computed tomography scanning of the head? For example, when there is bleeding, brain injury, and skull fractures in patients with head injuries, bleeding caused by a ruptured or leaking aneurysm in patients with sudden severe headaches, blood clot or bleeding within the brain shortly after a patient exhibits symptoms of a stroke, especially with a new technique called perfusion CT, disease and malformations of the skull, brain tumors, enlarged brain cavities, ventricles in patients with hydrocephalus. Also, we use computed tomography scan to perform and evaluate the extent of bone and soft tissue damage in patients with facial trauma, for example. And while we are planning surgical reconstruction, it helps to diagnose disease of the temporal bone on the side of the skull, which may be causing hearing problems. It determines whether inflammation or other changes are present in the paranasal sinuses. Also, plan radiation therapy for cancer of the brain or other tissues. It guides the passage of a needle while we need a tissue sample from the brain. Also assess aneurysms or arteriovenous malformations through a technique called CT angiography. And we have some kind of cases here, examples. For example, first is epidural hematoma, and epidural hematoma is usually associated with a skull fracture and often occurs when an impact fractures the calvarium and the fracture bone lacerates a dural artery or venous sinus. And the blood from this ruptured vessel collects between the skull and the dura. You see computed tomography, axial plane, soft tissue window, and inside the brain there is large hyperdense area. So if you compare this area to the brain, you can say that it is definitely hyperdense. Here you see that there is some fracture line in the skull, which caused this bleeding, after trauma bleeding. Also, if you compare soft tissue on this side and on this side, you can see difference because there is thickened soft tissue, and soft tissue density is higher than on this side. So we call this soft tissue swelling because of trauma again. Subarachnoid hemorrhage. Subarachnoid hemorrhage occurs with injury of small arteries or veins on the surface of the brain, and the ruptured vessel leads into the space between the pia and arachnoid matter. The most common cause of subarachnoid hemorrhage is trauma. In the absence of significant trauma, the most common cause of subarachnoid hemorrhage is the rupture of a cerebral aneurysm. Again, we have here axial plane of computed tomography, soft tissue window or brain window, and we see some hyperdense areas inside the brain. Computed magnetic resonance imaging of the brain, axial plane. Again, here we have hyper intense areas inside the brain. So while we are talking about computed tomography, we describe CT findings in densities: hyperdense, hypodense, and isodense. On MRI, we describe in intensity: hyper-intense, hypo-intense, and iso-intense. Hyper will be anything what will be more white in color than the brain. Hypo will be less darker than brain. For example, this area is hypo-intense if we compare to brain. And everything what has same intensity as brain will be iso-intense. So here we see that left Sylvian fissure and sulcis are filled with blood, hyper-intense blood. Subdural hematoma is a type of hematoma usually associated with traumatic brain injury, and blood gathers with the outermost Meininx layer between the dura and dura mater, which adheres to the skull and the arachnoid matters, and this arachnoid matter envelopes the brain. Here we have skull, dura mater, and arachnoid space. So subdural hematoma will be under the dura mater. Here we have example of subdural hematoma. We see here axial plane computed tomography of brain. Inside the brain, you see large area of hyperdense, large hyperdense area. And well, here we should see both of lateral ventricles, but we see only half part of one ventricle. Why? Because there is mass effect here, and this mass causes to change the shift of this area and covers the lateral ventricles. Subhemorrhagic stroke, which are due to rupture of a cerebral blood vessels, which can cause bleeding into or around the brain. Here we have magnetic resonance imaging, axial plane, and you see large hyper-intense area inside the brain. Here also on computed tomography, axial plane, we see a hemorrhage in the cerebellum. Is hyperdense. Hydrocephalus. What is hydrocephalus? When there is a problem with the ratio of production of cerebrospinal fluid and problem of reabsorption this cerebrospinal fluid, and it is most frequent in children. So normally lateral ventricles should appear such size, and in a hydrocephalic abnormal situation, we see enlarged lateral ventricles. Not only lateral ventricles, we have two lateral ventricles, third and fourth ventricle in the brain, and all these four ventricles may be enlarged while hydrocephalus, and we describe this hydrocephalus in the stages. So we have axial plane computed tomography of the brain, and you see that these lateral ventricles are too much enlarged. It takes almost half of brain area. Intracranial tumor generally present with a focal neurological deficit, seizure, or headaches. You see magnetic resonance imaging, axial, and computed tomography axial image of brain. Here we see hyperdense and here hyperintense areas. So around these hyperdense areas, you see a bit hypodense, like rim around this tumor. So we call this perifocal infiltration because of this tumor. Here, sometimes we see such perifocal infiltration process. Meningiomas are the most common extraaxial neoplasms of the brain, and mostly are affected middle-aged women, and 20% of meningiomas calcify on computed tomography. Meningiomas usually are isointense to gray matter, and here we see axial plane magnetic resonance imaging, hyper intense mass inside the brain. And here we see post-contrast CT, so intravenous contrast. Here was used a way of intravenous contrast material, and we see as a high density area, high density mass in the occipital lobe of the brain. Here we have all of these images are MRI of the brain, sagittal view, axial view, coronal, again sagittal, coronal, and axial view. So in T1 and flare, we have different sequences in MRI. This is T1, T2, and flare. In T1 and flare, fluid, so cerebrospinal fluid, for example, will be black in color, but on T2 image, it will be white. You see here examples of T2 images.